Assalamu alaikum, I'm Zishan. Welcome back to my channel. This video entitles Fact Check about Coronavirus. Let's start the video. First of all, we will have introduction. Coronavirus is the name of a family of viruses which cause diseases in humans and animals. This virus attacks the lungs and proves to be fatal in 2% of the cases generally. COVID-19 is sometimes referred to as novel coronavirus because this virus has not been previously found to be causing disease in humans. This infectious disease is wreaking havoc on human civilization. How many countries are affected by COVID-19? All the countries of the world seem to be yielding to this pandemic. COVID-19 is different from other coronaviruses which cause common cold in humans and those that caused SARS in 2002 and MERS in 2012. Where did this pandemic start? In Wuhan, a city in China, a cluster of cases appeared having symptoms of a new type of pneumonia in December 2019. Later, it was diagnosed that a new type of virus was causing these pneumonia-like symptoms in patients. This new virus was given the name of 2019 novel coronavirus by the World Health Organization. In February 2020, this virus was renamed as SARS-CoV-2. SARS stands for Severe Acute Respiratory Syndrome Coronavirus 2. This virus is named SARS-CoV-2 because it looks genetically identical to another coronavirus SARS which caused the SARS outbreak in the world in 2002. In order to keep things simple, this virus is called COVID-19 virus unofficially. Its official name is SARS-CoV-2. To make things easier, it is called COVID-19. Is COVID-19 disease zoonotic? COVID-19 is a zoonotic disease because it is thought to have begun in animals and then transmitted from animals to human beings. So, zoonotic disease is the one that begins in animals and then transmits somehow from animals to human beings. SARS and MERS were also zoonotic diseases like COVID-19. How to prevent COVID-19? These are some of the safety tips and precautions that can prevent COVID-19. First of all, stay home because it will keep you away from suspected or confirmed COVID-19 patients. 2. When you are sneezing or coughing, it is recommended to cover your nose and mouth with your bent elbow if you don't have a tissue or handkerchief. 3. Avoid touching your mouth, nose and eyes. 4. Should clean our hands often with soap and running water. Frequent use of alcohol-based hand sanitizers is also recommended. 5. Try to avoid visits to medical facilities in case of minor ailments. Online consultation with a qualified doctor is the best option in these circumstances. 6. Wear a surgical mask or at least cloth mask and adopt social distance. 7. Keep yourself at a safe distance from others. This safe distance may be from 3 to 6 feet. Don't approach a person who is coughing or sneezing. 8. When back home, dispose your mask carefully and wash hands with soap and water for at least 20 seconds. Next point is, what's the incubation period for COVID-19? How long does it take to develop symptoms when someone is exposed to COVID-19 virus? It takes 2 to 14 days. Majority of the patients develop symptoms from 6 to 10 days. Do symptomless patients spread virus? This is yet a debatable issue. Logic says that we should conceive that it happens. It is better for us to assume that symptomless patients do spread virus. In that case, we will keep ourselves away from suspected or confirmed COVID-19 patient. What are the symptoms of COVID-19 patients? The most frequently mentioned symptom in patients who are suffering from COVID-19 is fever. That is usually 101 to 102 degree Fahrenheit. Second most common symptom is dry cough that starts after fever in most of the cases. And number 3 is the tiredness. Fever, dry cough and tiredness are the 3 most common symptoms that are found in the patients of COVID-19. Less common symptoms of COVID-19 patient are aches and pains, sore throat, diarrhea, conjunctivitis, headache, loss of taste or smell, a rash on skin or discoloration of fingers or toes. The serious symptoms that may prove fatal for patients are difficulty breathing or shortness of breath, chest pain or pressure, loss of speech or movement. Do you suspect yourself a patient? What to do if you have suspicion that you might have been exposed to COVID-19? If you feel unwell and have mild symptoms like fever and cough, isolate yourself at home and observe your symptoms closely. this is the best option. But if you have difficulty breathing or serious symptoms, talk to your doctor or call your National Health Emergency Helpline for further guidance. Does COVID-19 have any cure or medicine? No. Unluckily, no. Good immunity is the key to recover from COVID-19 disease. How deadly is this disease? 2 to 3% die of it. 97 to 98% patients recover within days. It may prove fatal for anybody, but the older people and the ones who have other underlying ailments like cardiac problems, kidney issues, diabetes or asthmatic are at greater risk of developing life-threatening conditions. This is all from my side. I wish all of you a very healthy COVID-19 free life. May the patients who are suffering from COVID-19 recover fast. Take care, stay home, stay safe. Allah Hafiz.